There is a sexually transmitted infection more common than chlamydia, and most people have never heard of it. It is the most common curable STI in the world, yet it rarely makes the news. Most people who have it feel completely fine, and it is often left off the standard test. No panic, no shame. Just what the evidence actually says, calmly and clearly. This is trichomoniasis, and here are the numbers from the WHO, the CDC and the NHS. So what is it, exactly? Unlike most infections we talk about, this one is not a bacterium. It is not a virus either. Trichomoniasis is caused by a tiny single-celled parasite. The parasite is called Trichomonas vaginalis, and it moves using little whip-like tails. In women it settles in the lower genital tract, the vulva, vagina, cervix, and urethra. In men it lives mainly inside the urethra, the tube that runs through the penis. Because it is a parasite, not a virus, the right antibiotics can clear it completely. Now, how common is it? The scale genuinely surprises most people, including many doctors. In one recent year, the World Health Organization estimated 156 million new infections. That is among adults aged 15 to 49, right across the globe. It is the single biggest of the 4 common curable infections of its kind. Split roughly evenly, around 74 million in women and 83 million in men. In the United States alone, the CDC estimated over 2 million infections in 1 year. And unlike some infections, it is common well beyond the teens and 20s. Here is why it hides. Around 70% of people with it notice no symptoms at all. Someone can carry it for months, feel perfectly well, and pass it on without knowing. When symptoms do come, they usually appear within about 5 to 28 days. But here is the twist that keeps it circulating so quietly and so widely. In many places, trichomoniasis is not part of the routine sexual health screen. Standard tests often check for chlamydia and gonorrhea, but not this parasite. So even people who test regularly can miss it completely, year after year. When symptoms do appear, they differ between women and men, and are easy to dismiss. More than half of women with the infection notice some change in vaginal discharge. It can turn thin and frothy, yellow or green, sometimes with an unpleasant fishy smell. There may be itching, burning, or soreness around the genitals, and discomfort passing urine. Some women feel pain or discomfort during sex, which is easy to blame on something else. In men, only about 1 in 10 notices anything at all. There can be irritation inside the penis, or a burning feeling after peeing or ejaculating. Occasionally there is a thin discharge, but very often, in men, there is simply nothing. Why is it worth treating, if it so often feels like nothing? Because it does not stay harmless. The clearest concern is what it does to the risk of HIV. The WHO links trichomoniasis to roughly 1.5 times the risk of catching HIV. The inflammation it causes seems to make the body easier for other infections to enter. It can also make it easier to pass other sexually transmitted infections along. In pregnancy, an untreated infection is linked to real risks for the baby. That includes early delivery, low birth weight, and the waters breaking too soon. None of this is meant to frighten you. It is simply why quiet does not mean safe. So how does it spread? Through sexual contact with someone who already carries the parasite. That means vaginal sex, and sharing genital contact or sex toys with an infected partner. It passes in genital fluids, so full penetration is not always needed to catch it. It very rarely infects the mouth, the anus, or the hands, unlike some other infections. One myth to kill. You do not catch it from toilet seats, towels, or swimming pools. It needs close, intimate contact, and condoms, used properly, block most infections. The reassuring part is treatment, because this infection is genuinely straightforward to cure. If you have symptoms, a clinician can test with a simple swab or a urine sample. Because it is so often missed, it is worth asking specifically to be tested for it. That is especially true if a partner has been diagnosed, or symptoms keep coming back. The treatment itself is a short course of antibiotics, prescribed by a clinician. It clears the infection in the great majority of people who take it as directed. But there is one catch that trips a lot of people up. Reinfection happens in about 1 in 5 people within 3 months of treatment. That is usually because a partner was never treated and simply passes it straight back. So recent partners need testing and treating too, even if they feel completely well. So, 3 things to take away. 1. Trichomoniasis is extremely common and usually silent. 2. It rarely gets tested for, so ask directly if you are worried. 3. It is easily cured, but partners must be treated to stop it bouncing back. One last thing. This is general education, not medical advice, and I am not your doctor. If you might be at risk, a sexual health clinic has truly seen it all before. Every number here is sourced in the description. Go and check them for yourself. Follow for evidence-based health, explained. A new video every day.